Welcome to our Wednesday evening call, 7 p.m. Central Standard Time, every single Wednesday. So if you're out there, you're going and you want to sell, you want to learn how to do Medicare, you want to do it at a high level, cross-sell it with final expense, which is what we do best. If you want to go out there and you want to get some free merchandise from insurance companies, I just got this one in the mail, right? Awesome, from United Healthcare, nice zip up. Got the polo that literally just came in the mail today. You got to sell. Not only do you have to sell, but in addition to that, right, you got to have a good relationship with your reps. So I was able to get some killer merchandise from them. I ordered it through the mail and I just got it today. Some of it, they still owe me another like 4 or 5 shirts and some full zip up, some really, really cool stuff. I got some stuff for my wife too. So I ordered a bunch of different stuff. And the way that you get that with each different company is they have tiers and they give you marketing dollars as well. So, hook up with your Humana rep and ask them, how can I get some merchandise? I want to go out there and rep your brand, right? And I want to wear a different shirt every single day, when I'm out in the field. So I might want to have my UHC shirt. And that's what gets you in the door. Hey, this isn't the only company I work with, disclosure, right? I work with all of them. So just because you see this, they just gave me a free shirt. I like them, right? If they just say, I hate that company, well, good for you. So order that stuff. Every company, just reach out and get in touch with your local rep if you haven't already. So let's see. If you didn't order leads, yes, it is too late to order leads. We're already September 21st. So, but you can, go in the shopping cart, buy leads for Medicare is what I'm talking about. You can go in the shopping cart, you can get some leads, you can get final expense leads, you can buy final expense leads all throughout AP, up your order, and that'll help you. Okay, so what I'm going to do now is I'm going to do a little screen share here, and I'm going to open up Sunfire. As you guys see, I'm already in the search contacts. Where's this file? Here it is. Okay. Already in the search contacts phase over there. And what I'm going to do is I'm going to pull up some different or create some different cases. I don't need to do this right now, but you guys can kind of follow these steps. This actually just hit today for this update, which is pretty cool. So I'm guessing that if we look under the announcements section, Blaze Connect, call center. Okay, cool. Yeah, so there's some really cool features that they just added. They were actually supposed to be out on the 20th. So we'll do a little test run and see if some of the stuff is in here. So this will be, what is it? So let's do case study. Let's do lucky number 13 over here. We're just going to make up some stuff, Christy. Okay, we're making it on up. So we're going to start looking at this stuff over here. And we're going to see, I type in all the key information that you need. When you put in the zip code, sometimes they border different counties. I mean, there's some areas that have a different county, even though they're in the same zip code. So Red Oak and Duncanville, they're right next to each other, or pretty close to each other. I think those are the ones I'm thinking of in Dallas. So I want to go ahead and hit save and quote, unless I'm missing something. Can't have any numbers in there. Makes sense. So we're going to hit save and quote, go to the next one. You can do customer lookup, right? But that's not what I'm looking at. Generally, all this stuff I do not fill out. Right. I'm usually not clicking this button and then it pulls up all this different stuff. Okay. If someone has extra help, well, there you go. You would check yes. And then, however much it is, just like Gus, you did in the home today. So I'll uncheck that. And then I'll just hit view all plans. You can always go back to that right here, customer profile, and add just by clicking customer profile right here. And you can add the different stuff to change. Hey, they have extra help. You did a lookup. All right. So for this person over here, we see a lot of drugs, and anything that we found that was, let's say, for example, this person goes to the VA. Okay. And Christy, I might ask you to text me to make sure I got some stuff, just make sure I got all the data correctly. So any drugs, and I'm assuming all these drugs, because I see it on here, some come from the VA for some clients. So if it's a drug that comes from the VA, y'all, you don't need to be worried about that. So that's a cool thing, interesting thing. And just so you guys know, it's important, right? If a VA, Veteran Administration, they're going out there, they were a veteran, just so you guys know, if you're not familiar with what it is, and they can go and get healthcare from the VA since they served in the military, which is a great thing. Every VA is a little bit different, right? Some are good and some they don't like as much. So for this particular case, what we'll look at is someone that is going to the VA, and we'll see if they, and I'm pretty sure most of the drugs come from the VA anyways. I see, let's go ahead and save doctors. So we're going to add this doctor in here. So if they're on drugs from the VA, it doesn't matter, just so you know. Yes. So Daryl asked a question. He said, hey, I'm transitioning to Sunfire now. When checking extra help, does the med cost adjust? So yeah. So when you're in this customer profile, just so everyone knows. So while I'm on that page, before I go forward, I'm clicking this right here. I'm checking that box. You take any prescription drugs? Yes, if you do, or just I don't know. That way it's not red. Are you currently enrolled in a Medicare Advantage plan? I don't know. Who knows? And then over here, if you were to click, do you receive extra help? You would then, you would do it, and then it would automatically adjust the cost for all prescription drugs. So I'm going to uncheck that just to get out of it. All right, so we got one doctor in here, and let's see. So let me scroll up. If you guys have questions as I'm going through it, stop me, because I want to make sure that I can answer those questions over there. So right now, this client is hypothetically in a Humana PPO, right? I don't know the exact plan number. So generally what I would do is I would go ahead and I would look at pulling up Medicare.gov and creating an account for the client, helping them create an account. Go to Medicare.gov. You can actually do a customer lookup in Sunfire now, which is what it should be today, is what it was supposed to be. Well, the recording is supposed to happen today. The customer lookup is supposed to be, which is it's like a Medicare.gov feature inside of Sunfire, actually. So I sent out a link for that where they now update it, which is really, really cool. So depending on this client's in a Humana PPO plan. So depending on which plan that they're in, what I would do is, let's say, for example, they're in this, there's 3 PPOs. Okay. So if I was just to policy type here on the left-hand side, so y'all could see it, if I was to check PPO, right, it would only come up with these ones. And then there's also an RPPO, which stands for regional PPO. So I'm on the border of Oklahoma, where I am in North Texas. So that borders it. So you'd have an RPPO, a regional PPO. All right. So when I look at it, if I need to type drugs in, I can. But for a vet, right, for someone that goes to some doctors outside of the VA, right, if they're going to one doctor outside of the VA, but the rest of the care that they get is from the VA, maybe what I want to do, if they're in this Humana plan, one of them, I don't know which one, right? Let's say it's $79 a month for the monthly premium. This one's $63 a month for the monthly premium. This one is $0. In fact, it's -10. Look at that. It's a Part B give back of $10. So they're actually paying $10 of that Part B premium. So that is really, really, really cool. So let me see over here. Let me just check. Let's see. All right. So with that said, and I'll always look at my text message to see if any of y'all got any questions while I'm doing it. All right. So with that said, the Part B give back being $10, that's going to increase the Social Security check and reduce how much they're paying. Part B premium for next year, just so you guys know, I don't know what that's going to be as of right now, right? I don't have an answer. I would guess, if you guys saw what the commissions went up for this past year, it's been the lowest increase percentage wise, right, that we've seen in, wow, I don't know, maybe like 6-7 years, probably somewhere in that ballpark. We only went up 4.5%. Meanwhile, the cost of everything went up. So that was, really crazy to see that. As far as that goes, for that, it's kind of unfortunate for us, but what can we say? That's kind of is what it is. Usually it goes up 5.56%. Last year was 6.2%. So that was a pretty dang heavy increase. So they knocked us down by 1.7. I don't have a say in it. It's the federal government, right? Every administration that comes in determines things differently, right? They all vote different. So as far as that goes, I would say that the Part B premium, it went up like crazy last year from $148.50 to $170.10. Whereas the year before that, it went from 2019, it was 134. Then we went to 140, then 144, and then 170. or 148.50 rather, 148.50 then 170, which is just like crazy. So I would anticipate for our seniors that these give back plans are going to become more and more popular as the cost goes up, because the seniors get what's called a COLA, which is a cost of living adjustment. And that's based on inflation and all of that stuff. So when we look at inflation and those costs, if it was based on inflation, yeah, they'd be getting like a 15-20% increase. But the Fed only says it's what, 6%. That's so off. So off. If you go to buy anything, you guys know that. So as far as that goes, the COLA is going to increase our client's Social Security check. What's forecasted is about 8 to 10% increase in our client's Social Security check. So that's great. Last year was 6%. That was pretty, it was 5.9%. So it was pretty high. So keep this stuff in mind as we go through AEP is, hey, the cost of the Part B premium is going to go up. So in this area, it's a great PPO. It's 4 out of 5 stars. It's a good quality plan. The doctor is in network with this company, right? With Humana, with their PPOs. And who knows, this client could be in this PPO, right? That's $79 a month. And all of a sudden you sit down with them and you enroll them in a 0 premium PPO with a $10 give back. So now their Social Security check is not only going up by $79, but an extra $10 a month for the Part B premium give back. So it's an $89 a month, basically $90 times 12. That's $1,080, basically what it is. So, or $1,068 if you do the actual math. So with that said, right, we're looking at it now. And then what I would do is I would just do a comparison, right? And then also with some clients, keep in mind, some clients, $10 makes a difference. Some clients, $10 makes no difference. Okay. I'm selling on the different value of what it provides. So let's say, for example, if this client was in this plan, okay, and we'll also look at this one over here, this $79 a month one. And then we also decide to look at, we could stick with a PPO. If we look at, we got the Humana one here, we have an Aetna Medicare one over here too, which is a $4,500 in network out of pocket. I know this plan's actually good, but it says the doctor is not a network. So I would always just double check this doctor and Control-C, Control-V, let's go, St. Louis, Missouri. And I would just try and find their website. So Health News, Doximity, Medical News Today, Healthline, grades. Okay. Share Care is an internal medicine. Okay. So here you go. So that's the doctor's office, or that's the name of it. It tells you where at least he's located. Share Care is not where the guy is. So Barnes Residency. So yeah, so we don't see that it takes United Healthcare on this website right here. This isn't the website of where he works. So that's one of the things that I would do is ask, hey, what hospital is this guy at? And then I would Google the hospital name itself, and just try and see. So numerous hospitals, he's associated with numerous different hospitals. I would just ask that question. Hey, what hospital are you at? Which one do you work at? Here's a phone number, right? So I would try calling that, check insurance information. That's pretty cool that's got that right over there. And there you go, even though the guy doesn't have a website. So that's pretty dang awesome. It's got every single company on here that the guy takes. Medicare Advantage, Medicare Advantage, Medicare Advantage. There's the Walgreens PPO right here. So if I was going off this on Google, it says that he takes it, but I always want to do a little bit more due diligence because I don't want to lose a sale because, I wasn't 100%, right? I don't want to put someone in a bad situation. It's our job. It's our responsibility as producers to make sure we do that. So with that said, okay, do just a little bit of work and, go ahead and give him a phone call. All right. So now what I want to do is we could just say, hypothetically, we call him and this is in here. What I also want to do actually real quick, guys, is I want to just search for Part B give back plans. Okay. So there's none that are a PPO. Okay. That's fine. But right here, what I see, right, is that there is an HMO that the doctor does not take according to Sunfire. Just keep in mind that they only get what the insurance companies give them. Okay. And sometimes you call the office, the doctor's office, and they take it, but it may not say it on here. So that's all right. So we just want to at least be aware of that. Or maybe this guy doesn't even care about the doctor. He's like, I don't even care who it is. Right. So just because in your mind, you're like, oh, this is the doctor they go to. Sometimes they're like, I don't even go to the doctor. I don't even know who this person is. Like, I don't even go see him. I don't care. Just give me a doctor. I haven't gone to the doctor in 5 years. If you're like me, I mean, I don't go, right? Unless I'm sick. So right over there, that's, kind of a good thing to even check, because increasing someone's social security check by $55 a month is pretty dang cool. So what I would do is, after finding those 3 plans, is I would just do a comparison and just kind of see. So the plan that is Humana's $79 a month is in the center, the $10 give back from Humana's on the left-hand side. And then the AARP Walgreens PPO is on the right-hand side, which is also a 0 premium PPO. So what I then do is I just start to scroll through it and kind of see the different benefits. So ambulance with the PPO, the give back is $290, $265 with the $79 a month plan, and $270 with our PPO from AARP. Chiropractic is the same across the board, so that's pretty cool. Now, when we look at it, we see $2,000 in dental for the Humana plan. And the downside is we see a lot of different co-insurance, right? So sometimes co-insurance, it makes a big difference, right? That means that they got to pay 70% of the bill, 50% of the bill for restorative services, right? Don't know what that is? It's okay. You go down to the evidence of coverage at the bottom and basically copy and paste that and type it on in. So we can literally, I'll skip all the way to the bottom of the page here, go to the evidence of coverage. You saw the button I just clicked. I hit Control F to find on page. Go ahead and I type that on in here. See if it's got anything that pulls on up. Sure, it's probably going to have something. Nope, doesn't have anything. You can also just type in dental and then something will come up. And then you can just see what would be covered under there just by reading through this and figuring out what it would be that's going to be covered. So as you can tell, there's 38 different things under there. Inpatient covered services received in a hospital or skilled nursing facility during a non-covered inpatient stay. So it breaks down all that stuff for the dental, and you just keep going through it and just read the stuff. I mean, honestly, that's as simple as it is really just reading everything. All right, so you get the point with that. All right, so now let's scroll back up to where we were with a chiropractor. Okay, and keep in mind that this stuff is all in alphabetical order. So we have our dental, it's all alphabetical, so right beneath chiropractor. Okay, so we have our $2,000 over there, and then some co-insurance. This one, not dental rich, just got preventative. That's it. Otherwise, you pay money. Preventative over here is $1,000 with United Healthcare, right? And same thing, you get, some cleaning, 0%, 70%, maximum 6 visits per year. I don't know, someone that gets their teeth cleaned 6 times a year. I don't know if it's good to even do that. This one gives 3 fluoride treatment, oral exam. So pretty much the same thing on the top side, just a different maximum benefit amount of $1,000. So also keep in mind, like if we're looking at this and someone has dentures, like does that make a difference? They're like, dental doesn't mean anything to me. I have dentures. Okay. Do you need your dentures realigned? Right. So over time, the dentures might wear, they might, they're chewing food. So they can do what's called a realignment, right? Where they mold it and they fix the dentures that they currently have and they don't have to get them new ones. So you can always ask that question. Hey, do you need them realigned? And that's not that expensive. You can get dentures for $600, right? But here's the difference, guys. So this gives $2,000, right? With the Humana, but it has all these co-insurance. Now check this out. This gives $1,000 with no co-insurance. This is Medicare covered benefit. So that's usually the same for most plans. There's going to be a cost to it for Medicare covered benefit. But for all the rest of the stuff, it's a $0 copayment. So that's pretty impressive. That means that they can use this full $1,000 right there towards all of this stuff. Whereas over here, you have to pay 50% of the bill, and they'll pay some of it, right? But you got to pay 50 to 70% of the other. So keep that in mind when you're looking through this stuff and how we walk through it to see what provides value to our clients and what makes sense. So I look at other things. I say, hey, what about this next one? Diagnostic test, lab and radiology services, and x-rays. I have clients that ask me all the time, hey, what's the cost of an x-ray? Over here with this plan, 10 to 40 bucks. This United Healthcare plan, $15. The one in the center, I'm not really going to pay attention to it anymore. It's 80 bucks a month. So the reason why I put it in here is hypothetically, if they were in the plan, that's $79 a month. Well, that's easy to change them with the same company to the $10 give back plan, because it's clearly more rich in benefits than this one as of right now. So you just look at this different costs and see, all right, lab services are over here, 0 to 30. So you just read through it and just kind of see what it is. Let's scroll down, doctor office visits over here. Okay. So doctor office visits, we have $10 if they go see a PCP. Okay. That can make a difference to someone, especially if this one's $0, right? How often? The next question is, well, how often do you go see your primary care physician? Well, the answer is going to be one time a year, twice a year, once a quarter, right? What is their health? So let's just say it's once a quarter, which is a substantial amount to see a doctor in a year, to be honest with you. I mean, most people are not going to see a doctor that frequently, but as we age, our health changes. So $10 is what it's going to be there. So 10 times 4, that's $40. Okay. So $40 if they went once per quarter, right? And here it's $0. So that'd be $0 for the whole year. So if you think about it, well, you're getting a give back of $10 per month. That's $120. So you still made out by $80, right? 120 total give back for annual, plus or minus the $40 you spent at a PCP. Specialist is the same for both of those plans. And then I would look at, durable medical equipment is pretty much the same with every plan. Just so you guys know, it's 20%. It's a Medicare coverage service. As you can read here, co-insurance for Medicare covered durable medical equipment. That's going to be your oxygen tank, your wheelchair, portable oxygen tanks, stuff like that. Emergency care is generally the same for most plans, $90, but sometimes you'll see it at 120, right? So that's good to see that it's the same. Hearing services, right? Do you need hearing aids, right? My wife says I need hearing aids, right? But I don't think I do. So it's up to you guys. You kind of look at that and you look at the different costs. So $375. I had one client that told me, hey, hearing aids are important to me. Okay, so if hearing aids are important, would I go with a plan that has a higher copayment or lower copayment for hearing aids? I'd go with the one that has lower. Or I'd go with a plan that offers hearing aids, or WellCare offers a flex card towards hearing aids. So maybe we can go with that one. Otherwise, and if someone's really healthy, that might make sense. So home healthcare, $0, optional benefits. We're not worried about that. It's not included in either. Let's scroll down to outpatient surgery. So $295, $40 to $295, $0 to $250. That's a pretty big difference in terms of cost. But once again, they're getting $10 back a month. Over here, $50 every 3 months, right? Or $200 for the year and over-the-counter items. This one has $0 with the United Healthcare one. So that's a big, big part for some clients. Some don't care, don't use it. That's a tremendous point for you guys to be driving home, right? So let's stay on that for actually just a moment here. So $50, right? What do we want to do? We want to go to my website here. We're going to go to the Medicare agent portal. We're going to go to portal training, right? We're going to scroll down. Just so you guys know, I updated the Sunfire training link. And let me see over here, actually. Let me see 1 second. I updated it today. It looks like it's good to go on that side. Okay, cool. So yeah, so Sunfire training, yeah, it is updated. Okay, so this is the updates. I'm going to update it once again as soon as we get all the final stuff. All right, so sticking with that thought, we have all of our over-the-counter catalogs, right? So the year, they do change year over year, right? So I think this one's probably a 2022. Ask your rep to send you one. And then we'll go to Humana OTC catalog, and you just go over the stuff with them. And all that you do is you just show them, hey, this is the different stuff that you can order. And I'm showing them this stuff, while I'm with them, right? I want to show them all of these different items that they can order while I'm with them here. And you basically just look around the house, I mean, that's really all that I do is I look around the house and I just see, do you have a hydrogen peroxide bottle sticking out? Do you have some vitamins that are on the table, right? Do you have bandages that are on the table? Do you use toothpaste? Do you have a toothbrush, right? So like stuff like that, I'm literally just looking around. Do you have a bottle of aspirin or Tylenol around, right? So just look around the environment, just be aware of your environment, see if there's different stuff that they use. Hey, do you take vitamins? If not, you probably should, right? Highly recommend it. So you just show them this stuff. This is United Healthcare one. It's from 2021. So I should probably get it. I probably have the updated one. But with that said, that's a big pitch right there, right? $50. That can be a turning point for someone. I've had a lot of clients that say, hey, I take supplements. This is how much I'm paying for it. Okay, cool. It's good to know. So now what we want to do is we want to keep on rolling through this stuff. Vision, urgent care, $10 to $40. This one's just 40 at a flat rate. And when it says 10 to 40, it depends where you go and the doctor. So the next one that we want to look at is vision over here. It's a $0 for an eye exam, $75 for maximum benefit every year for in and out of network services. Okay, so prior auth required for eye exams. And then eyeglasses, they give you $100 towards every year for non-Medicare covered eyewear. So that's pretty cool that they'll give you $100 towards that. The UHC, so if eyeglasses are really important to them and they don't care so much about the over-the-counter, well, you get $100 extra. That's a good point for you guys. Now, here's where it can really, the benefits can be outweighed over here by this dollar amount, right? Which is your inpatient hospitalization. So that inpatient hospitalization, $295 per day for days 1 through 5. If they're currently in this plan where they're paying $360 per day for 5 days, that's a $65 per day difference. With the UHC from the Humana and the Center is $60 per day for 5 days, right? That adds up. We're dealing with the senior market who's on a fixed income, right? So you guys need to really make sure that we're going through all that stuff. Of course, I would put the drugs in normally and do a little comparison with that. So that is our first case study over here. So let's go ahead and search contacts. We're going to go ahead and hit add new contact. I got one more for y'all to pull up. So let me move that over here and let's start on looking at this one. Okay. So this one over here, we have case female study, hypothetically, if this was a female, 63010. And then what I want to do is I like to put in as much information as I can. And the reason why date of birth can be so important is because it could be for a Medicare supplement, right? So you want to do that now. Now here with this, you actually do not put in their gender, right? So that's kind of weird that you can't do it here. So let's say, for example, that we were looking at a Medicare supplement. Oh, these rates look great, right? It defaults to female. So you want to go in here and you want to hit edit, right? What's the effective date of the policy? Let's do 10/1, right? Female, non-tobacco, household discount. Do they have one or don't have one? Right? Save customer details, meaning the husband and the wife, it's part of the household. They both have it. So yeah, so I would go in there and just make that little adjustment. Okay, cool. So now we're looking through this one and we see that, you know, if we were sitting down with these people, we see that they both have the Humana plan. They both have the same PPO for, let's say it's a husband and wife combo. And then, like I said, we would go in there and we would type in all of the doctors' names, all the medications, and we would go to Medicare.gov and soon to be on here, which is going to be really, really cool, that we're going to be able to kind of skip that step, right? And go directly to Sunfire, which is freaking awesome. I'm really pumped for that, having that step, right? So that is going to be amazing. Hydrochloroquine, I think is the spelling of it. Hydrochloroquine. 1 second, I'm spelling it wrong. Let me see. Let me get the spelling on this. Thought it was spelled that way. Maybe I typed it in wrong. Hydrochloroquine. Oh, hydroxy. Okay, cool. All right, so I found the right one. All right, so yeah, so that's a big thing. So now Sunfire is actually going to show us what previous plans they had. So here's the thing, guys. So with that, because that's a good note for me to kind of tell you guys, is I don't know how many, in terms of plans, I don't know how many years that they're going to go back to show us, okay, what they had. I mean, are they going to show us that the client was on, you know, just last year's plan, or are they going to show us, you know, 10 years of data or all the, you know, the life of the policy? So if you look at Medicare.gov and when you're looking at the client's cases, you know, you can really pull it on up and say, hey, you know, for the clients, this, or well, just in general, because it gives us a case, a fighting case, right, to make a logical argument to the client, right? This is the plans that you were in the past, and why did you leave that company? I mean, y'all have seen me do it many times, if they're in Humana, I'm just like, why'd you leave Humana? And they're like, I don't know. Someone told me, XYZ insurance company was better. Oh, that's weird. How do you like it? Well, I don't really like this, or I like this, and this is, kind of what it's missing. Okay, cool. Well, good news is the plan that you were in before had that, right? One note here too, guys, as well as when you're writing down the names, which I'm not saying you didn't, but because this was a phenomenal job in putting everything together. Make sure that you're always writing down the city that they're located in for the doctors. Make sure you're also always writing down the, so not only city, but, city, the state. Let's see here. And I don't need the county per se, but and the first name is really important, and what their specialty is, right? Because you might have to go to Google, right? So let's just say, for example, you sent me this, you sent me Smith, and Smith is a rheumatologist, primary care doctor. Okay, you just wrote Smith on there. Great. Which one? Right? Gregory. Okay. Craig. There's a couple of Craigs, right? So just make sure you're writing in that last name too. All right. So we're going to go ahead here and we're going to hit save doctors, just like we normally do. I know this might be boring for some of y'all, but repetition is what makes you great at things. So now look at this. Boom. I got Aetna PP over here, which we didn't look at before. Okay. I see the estimated annual drug cost, $852. Oh, wait a second. Look at that. Here you go. Humana Gold Plus has it all. The Humana Gold Plus is a pretty dang killer plan. It's generally more rich in benefits, right, than the PPOs, pretty much always. And they take that. And then we also have this Aetna Medicare Gold Advantage Prime, right? So let's check these three out, right? These are three completely different plans now. We got the current PPO. In the center, we have the Gold Plus, which, as you guys know, the Gold Plus nationally is a great plan. And then we have the Aetna Medicare Gold Prime. So let me see 1 second. Sorry, I just wanted to respond to that text message. Okay, there we go. Got that done. All right, so now we want to look at all these different plans here and just kind of see what's going on. All right, so let's start off with our additional services. Sometimes like you'll see something like a personal emergency response system in here, which is also known as PERS. My plan has it in my area, and I know United Healthcare has it, and I'm pretty sure Humana has something very similar to it. But as you see over here, like in this additional service section, silver sneakers. So all plans have something like this in here too. There is also, what I'm going to do for y'all is I'm going to pull up the Go 365 for 2023. Guys, I know we went over this last time, but I got to do it again, right? Check this out. This is freaking awesome for your clients that have Humana. For next year in 2023, here's the program. What do these clients get, right? For doing your annual wellness exam, going to see your doctor every year, and we're going to give you $25, right? Okay, that's awesome. Mammogram, $30. Also the question that people always ask me is, what do I get? All right, here we go. So right here, what does that $25 go to? It's going towards these gift cards. They're going to actually send you out a gift card for all this freaking stuff. How cool is that? You like Panera Bread, you like Lowe's, right? I mean, I see you got mulch in the front of your house. Looks like it needs to be replaced. That's about $3 a bag, right? Go to Lowe's, go get some more mulch, right? Walmart. Do you go to Walmart? Where's your grocery store? You like TJ Maxx, Marshall's, Home Goods, your shirt's got some holes in it, I'd recommend getting some more. So all this other stuff over here, attend a class, neighborhood class, $5. You can read this stuff over here. It's pretty cool. So, I mean, if you were just to add up all that stuff, 25, 30, either 20 and 50, I don't know the difference between that. Says read it somewhere down here. So that's a footer note, I'd say, for 2 and 4. Wherever the footer is, here we go. Procedures for these preventative screenings activities align with healthcare effectiveness data and information sent to this. And then the screening is included in Medicare Advantage stars recognition, PCP quality, right? Okay. So whatever that means, right? So if you just did the math on this, right? You're going to be, let's actually take out the calculator, because you guys do need to know this. The max amount that they can get for doing all this stuff for just the first line over here, without going to the bottom one, is $160, right? 12 workouts per month, tracked via Silver Sneakers fitness device online. So they could literally go into the gym. They're going to send that report. You get another $5. And then for all these ones, 5, 10, 15, 20, 25, 30, 35, 40, right? That's another $40. So annual gift cards that your clients can get comes out to $205, guys. That's pretty freaking cool. So if that ain't a part of your pitch, I mean, you got to get that stuff right. Right. So that is pretty dang cool. And the other one that I want to show you guys too, and remember, this is stuff you got to be saying in every single home, right? This is crucial stuff to be telling your clients. So let's look at the United Healthcare one, right? So that was 205. Okay. For that, this is a UHC one, $180. Right? Are your clients even doing this stuff right now? $5 to get a flu shot. Hey, do you get your flu shot every year? Yeah, it's free through your health insurance. Okay, it's not just is it free, but you get $5. Paperless opt-in, $5. Text messaging opt-in, $5. Right? Physical activity up to $120, $10 per month. House call visits, right? More information, stuff like that. If they do a health assessment, they get $10. So the client gets $10 for doing a health assessment. You get $75 in 2023. That's freaking crazy. If you wrote 100 apps during AEP and did a health assessment with every single one, and it was 100 apps just with UHC, that's $7,500 of free non-chargebackable money. Stupid. Makes no sense, right? Makes no sense. $60 with Humana, right? They upped it from 50 in 2023. They upped it from 50 to $60. That's pretty dang cool. So, right. And then Aetna, I think, is staying at 70, but I don't know 100%. I didn't get a notification for it yet. And then WellCare is currently at $125, but only for C-SNPs and D-SNPs, not for regular Advantage plans. So that's kind of the downside. So yeah, so I mean, for you guys, you know, looking at this stuff, it's just crazy, right? It makes no sense. You're just getting paid money for no reason. And it's that compounding effect. I mean, my renewals are stupid. And I personally decided to focus more on Medicare myself and the growth of that. Sorry, someone's unmuted. Let me mute them real quick. I personally decided to focus on just the growth of my renewals itself, right, on a larger front, and not grow my final expense agency as much. So I took a step away from massive final expense growth to build a massive downline on the Medicare side and roll this out to every single person on the Medicare side and become the best on the Medicare side and become a top producer on the Medicare side, doing it myself first before teaching it to anyone else. Right. So initially, hey, my income went down a little bit, but now next year, 2023, my income is going to be stupid high in renewals, change your life type money. And that's the big thing. And I know it's hard to sometimes see it when you're green and you're new to it, because right now it's like you're getting paid like nothing for an app. You're like, ah, cool. All right, I made, $100 or, whatever it is. 24 times 3 is what you're getting paid right now. So I think that's like $72, right? It's like whoop-de-doo, but you get $50 for a health assessment too. So that's a nice little bonus for free money. I think literally Gustavo just say, yeah, free money. It's literally free money. And it just compounds, right? But I want you guys to keep something in mind too. Right now, you may only be getting paid $72 for an app for an effective date 10/1, right? And that's not for new to Medicare, just an existing one. But also keep in mind, you got to take that 24 and you got to multiply that by 12, right? So that's going to be next year, you're getting that $287, right? I mean, you're getting the money again next year, and you're getting the money again the following year, and then the following year, and the following year, and the following year. So don't be short-sighted just because the deposit's not as crazy as you want it to be. Like, oh, like $72. I'll tell you, in my career, Medicare money earlier on, right, had just saved me, right? You got bills that come due, whatever it is. You got a big lead bill. You got $3,000 of leads that you owe money on, right? And we know what happens with leads. Those are an asset. And then all of a sudden, boom, you get a deposit from an insurance company for $5,000 from all this business that accumulated that you wrote, and you don't know why you get true ups or when you get true ups, which just so you guys know, that's someone that's new to Medicare Advantage, right? Sometimes you're like, this person's a true up. You didn't even know it. You're like shocked. Like, dang, now I got paid $573, right? For that. And next year, right? It's, 301 times 2, 602, $602. You just get those. And it's just like, it's surprise deposits that you get because you just think, or we all think in our minds that we're just getting a deposit. Oh, this person is, there's no way they're new to Medicare. You look at it, you enroll them in a plan, right? New to Medicare Advantage, rather. You enroll them in a plan, you get the first deposit. And then they pay true ups once a month. And then all of a sudden, you have 10 true ups for another $300. That's $3,000 that hits. And then you get your health assessments once a month, right? And let's say you wrote 15 that month. Okay. So every 10 is $750, right? So every 10, $750. Like it's just with United Healthcare, but other companies, $60 with Humana. All right. So let's get back to this case real quick so I can just present this again for you guys. So ground ambulance, I forgot which one's Gold Plus right here. Humana Choice PPO in the center, which is the give back. Aetna Medicare Advantage Gold Prime, which is pretty cool. So let's go to our ground ambulance, $290. Ground ambulance, $290. Aetna's coming in the cheapest, $280. Okay, that's pretty cool. Chiropractic, $20 across the board. Dental, we already know the dental with the PPO, which is in the center. Okay, here's the downside of this Aetna plan right here, guys. $2,000 reimbursement. So you got to get the bill first, right? They want you to pay the bill first and we'll send you back a check. Okay, right? So that's something that I would urge you guys to get with your reps and see. So if I'm gonna go to the evidence of coverage, what I just clicked over here, and I want to see, also I want to get on the phone with them and talk to it because the plans do change by area. So let's see. So we're to send a request asking us to pay for our share of the cost for medical care or drug you have received. For more information on situations in which, excuse me, you may need to ask us for reimbursement or to pay a bill you have received from a provider, see Chapter 7, right? Asking us to pay our share of a bill you have received for covered medical services or drugs. So I would, once again, I'm going to click that reimbursement and see. Looks like this is on the same page and there's 42 different different lines where it says reimbursement. So dental services, your benefit covers most dental treatments with the exception of cosmetic services. You will be required to pay for services up front and submit for reimbursement. That's not cool, guys. They don't like it, right? But here's the thing, okay? It's going to cover your oral exams, your cleanings, your fluoride treatment, your dental x-rays. It's going to cover that $0, right? $0 copay. But for services, it says, hey, you will be required to pay for services up front and submit for reimbursement. That's not too hot. I'm going to guarantee you some people ain't going to like that. All right. So you guys kind of get the drill on that one. So that was dental. So let's go to our doctor office visits. So if they're in this $10 give back, right? But they don't pay the premium, the Part B premium because their income's low, right? Not low enough to be on full Medicaid. This is a $0, right? For the doctor office. This one's $35 for a specialist. This Aetna one is $30 for a specialist. So Aetna's winning there on that end. They won in a couple of situations. Emergency care is $120 here, $90 with the PPO, and $120 with the Aetna PPO. Home health care, $0, $0. Rehab, Aetna services, cool. All right. Yeah, surgeries, $200. So that's pretty cool. This one's up to $245, so that's pretty high. This one's $295, so that is definitely high. This one gives $60 in their over-the-counter catalog every 3 months. This HMO only gives $25. So it clearly looks like to me, I mean, there's really no reason to be in the HMO when the PPO, or depending on what you're looking at, dental is better with that one. But the PPO has got $50. So that PPO give back plan in this area, in the St. Louis area with this plan is freaking killer. I'll tell you that much. Vision, we got $200 with the HMO. So vision is the most important. There we go. The PPO, $100, and then the Aetna is $300. So if Aetna, if you need vision, that's it. But check this out right here, guys. $245 for the inpatient hospitalization, but it's for 8 days, right? So it depends which way you're going with the pitch, right? One is, hey, most people don't go in the hospital for 8 days, but if you did, that's how much your bill would be, 245 times 8. And hey, if you were in this plan, it's $295 for only 5 days. Do the math, see which one works out. Extra $50 per day, right? For let's say it's 3 additional days, or actually, no, it'd be a total of 3 additional days at $245. So they could win depending on how many days they're in the hospital, right? They could save $50 per day, or if they're in there for 8 days, they could lose, which is why you got to be pitching the hospital indemnity. All right. So with that said, all the costs and everything along those lines, the PPO is really, really dominant, but the Gold Plus 2 is still a killer plan. This Aetna Medicare Gold Advantage Prime HMO is not a winner in this situation, but it's still a really, really good plan. And it is an HMO. So cool. All right. So what I'll do now is I want to stop share. I want to see if anyone has any questions at all. If you guys got some questions, comments, concerns, anything like that, let me know. I was prepared for AEP. If you didn't get an email for your leads, please email me and I will get on top of that. I'll be looking at everything to make sure that you guys have all of the stuff that you need to be prepared. Okay. So let's do that. I'll make sure that you guys are well prepared for it. I'm sending out, like I said, I'm going to send out the credit card authorization form. So that way, if you want to update it, just write a note in there, just say for Medicare somewhere. Ryan said, hey, why switch from PPO to HMO if docs don't matter? Yeah. So I'm a huge proponent, as you guys know. I love the PPOs. And that's just in general. Any health insurance agent is going to tell you a PPO is better than an HMO all day long, right? Because it's freedom, it's flexibility. So I personally prefer to have a PPO. But sometimes, we're dealing with the senior market. Sometimes what you see is these clients don't go anywhere. Like they literally don't go anywhere. So their network with the HMO, right? Their home network is okay. Right. And that's it. So they don't travel a lot. So PPO might not be as, attractive to them, or maybe, they really want some plans with the HMOs are just so much more rich in benefits, depending on the area. Of course, this one was a different situation. This is around St. Louis area, 63010. So in this situation, for me personally, I mean, that PPO is really, really rich in benefits, that Humana Choice PPO. So, I wouldn't even really want to make a change from that. But what I would look at, right, as I would look at the HMO and I would just compare the benefits. What's most important to you? Is flexibility with doctors important to you? No, I just go to one doctor. Okay, right? Perfect. But if you go to a specialist with some plans, right, if I go to the Part B give back, if you go to a specialist with this give back plan, we'll just scroll down to doctor, right? It's $5 for regular office visit and $50 for a specialist. And that's a give back example. I just went to the give back because I knew how much it was. So that could be one reason why, if the PPO is $50 for a specialist, but $20 with the HMO, that lower cost is what keeps clients with the HMOs, excuse me. If a client says they have TRICARE for life with their Medicare already, can we do anything? So that answer to the question is absolutely. We definitely can. Most of the complaints that you will get come from that specific situation with enrollments. So what does that mean? It means the primary is the Medicare Advantage plan. Any bills that you get have to be sent to TRICARE after that. Anything that is not paid by them, then Medicare picks up. It's 1, 2, 3. Okay. Medicare Advantage, then TRICARE. Right. And usually there's nothing left over after that. So that's the issue that we run into a lot, is the billing is not properly done. The client doesn't want to get a bill and then take time out of their day to send it to send it to TRICARE. And then it goes into, now they into debt collection because they never handled it. And what's easier? Keep your $0 copayment on most things with TRICARE, even though you might not have, the best of other benefits like included in these plans. Okay. Or, deal with the headache of getting a bill and send it to them. For me, it'd be a no-brainer. I'd take the Medicare Advantage plan in combo with TRICARE. I mean, TRICARE for life is amazing. So the answer to the question, can you do it? Yes, absolutely. Just be very clear with them on how it operates and they coordinate together. Okay. Otherwise, you'll get a complaint from it. I know from experience, right? I've done it before. I explained to the people, I sat down with them, looked them in the eye, and I told them exactly how I was going to operate. And no matter what, sometimes you can speak to people till you're blue in the face and it ain't going to work. And that's, just the way that it is. So it's all right. It happens. It's part of the game. It's part of the business. So great question, Cody. We just have to go through it and just talk to him and explain it to him. That's all I would do. That's all our job is anyways, just explaining stuff to people, presenting a logical argument as to why they should, go with the options that we present to them. If not, and you're in a great situation, stay with it. All right. So let me go to chat, see if there's any other questions in here. All right, cool. All right. So I appreciate everyone. If you guys have any questions, let me know. Like I said, if you didn't get an email for your leads yet, shoot me an email and I'll be on top of that tomorrow when I get back in my office. And I appreciate everyone. You all have a wonderful evening. AAP is about to kick off. Get your leads, get prepared, get to talking with these people. At the very least, you got your leads now, be prepared, go see them, be the first person in that door, right? Don't be getting from a client, oh, well, I already had this taken care of. I don't ever want to hear that, right? I want you guys to be the first people there. So buy as many leads as you can before the end of this month. So week 1 of when we can compliantly market the plans, remember, which is October 1st. We just can't submit apps till October 15th, right? So when AAP hits and the gates open, right, you got 40, 50 apps to submit day 1 and you're savage. So cool. Appreciate everyone. Have a wonderful evening.